Good day, everyone. Welcome to our webinar. I am Jayan, a second-year BS Pharmacy student, and I will be your host for today. But before we start, may I call on first Ms. Rhea Cerezo to lead us in opening prayer.
Diyos ng kataas-taasan sa lahat, kayo lamang po nangangalang Jehovah. Kami po ay lumalapit po sa inyo sa pamamagitan ng panalangin. Nagpapasalamat po sa lahat po ng blessings na binigay niyo po sa amin ngayong araw. Ama, kami po ay magkakaroon ng webinar. Sana po matapos po namin ito ng maayos. Kami po ay humihingi ng kapatawaran sa mga kasalanan po namin nang sa ganun po ay maging malinis po kami sa inyong harapan. Ama, amin po itong ipinapahatid dyan sa inyong banal na luklukan sa pangalan po lamang ng inyong bugtong na anak na si Jesus. Amen.
Thank you, Ms. Cerezo. Now, for today's webinar, isa lang masasabi ko. We are privileged that we are here, and we will learn or gain knowledge rather about IM. IM stands for Integrative Medicine, where this is a healing-oriented medicine that takes account of the whole person, including all aspects of lifestyle. But it has also a risk to take. So, without further ado, I would like to call our first speaker who will give information on what is integrative medicine and its risks. Let's welcome Ms. Noreen Pinulyar, ang tirador ng Buy One Take One, Wipes sa Watson.
Good afternoon, everyone. For today's webinar topic is Integrative Medicine, Understanding the Integrative Medicine. For today's discussion, what is Integrative Medicine or IM? What are the common practices of Integrative Medicine? The principles of Integrative Medicine, advantages of Integrative Medicine, risks of Integrative Medicine, and the criticisms of Integrative Medicine. For the introduction, complementary and alternative medicine, or COM, is the popular name for healthcare practices that traditionally have not been part of conventional medicine. In many cases, as evidence of efficacy and safety grows, these therapies are being combined with conventional medicine. Thus, the term alternative have been dropped and replaced with newer terms such as complementary and integrative medicine and health, or just integrative medicine. Basically, integrative medicine is a combination of the complementary and alternative medicine that is being used until now to treat different types of conditions. What is integrative medicine? According to the Arizona Center for Integrative Medicine, it is a healing-oriented medicine that takes account of the whole person, body, mind, and spirit, including all aspects of lifestyle. In integrative medicine, it is not only the illness of a patient is being treated, but rather the whole person, the whole individual, its body, mind, and spirit. When we say aspect of lifestyle, it includes the physical, emotional, mental, spiritual, social, and environmental influences that affects a person's health. It emphasizes the therapeutic relationship and makes use of all appropriate therapies, both conventional and alternative. When we say conventional, it refers to a system in which the doctors and other healthcare professionals, such as the nurses, pharmacists, and therapists, they are the one who treat the patient. In conventional medicine, they are using medicated drugs, radiation, or surgery to treat an illness or a disease of a patient. While in alternative medicine, it is the other healing modalities that is being used to treat a patient They are using dietary supplements, other practices like the yoga therapy, massage therapy, meditation, and many more. Integrative medicine is created to provide holistic approach to the patients and help them regain and maintain optimal health. In integrative medicine, it is important to have a patient and practitioner relationship. Why? Because if you have a good relationship with your patient, it is very easy for them to treat. It is very easy for them to tell all their feelings related to their illness, and as a practitioner, you can easily help them and find a way that suits them to treat their illness. In integrative medicine, they can treat different kinds of conditions like the chronic pains, the movement disorders, the medical cancer treatment side effects, digestive diseases, stress, and anxiety. That's all. Thank you.
Thank you, Ms. Pinulyar, for sharing your knowledge on what is integrative medicine. Now, for the next topic, let me introduce our second speaker that will share information about the common practices and principles of integrative medicine. I know we are all excited, so let's welcome Ms. Princess Andoy, ang tamad bumaba sa fourth floor.
Good day, everyone. So now we will talk about the common practices of integrative medicine. First is the aromatherapy. Aromatherapy is a holistic healing treatment that uses natural plant extracts to promote health and well-being. Sometimes it's called essential oil therapy. It is used to promote relaxations and help relieve stress. No. Aromatherapy, it has also been used to help treat a wide range of physical and mental conditions, including burns, infections, depressions, insomnia, and high blood pressures. Essential oils, nakukuha siya sa different parts of plants like sa roots, barks, and the flowers. And this oil will mix with other substances such as baby oil or an alcohol before you applied it into the skin. Or either pwede din siya na essential oil alone lang when you put it sa diffuser. For example, you use essential oils to treat anxiety, stress, by inhaling it lang. So, paano yon? It is because itong essential oil contains a volatile oil or organic compound na nag-exert ng pharmacological effects when they penetrate the body either through our skin or from inhaling it through the nose. So here's the video of aromatherapy.
Aromatherapy is widely practiced to stimulate, promote, and even enhance the healing process by inhaling beneficial fragrances from essential oils. Everyone's reason for using aromatherapy is different, so know yours. If you're using scents to bring harmony or relaxation to any home, hotel, office, or car, then a beginner's starter kit is encouraged. These
Next is the massage therapy. It is the manipulation of soft tissues in the body. Massage techniques are commonly applied with the hands, fingers, elbows, knees, forearms, feet, or a device. The purpose of massage therapy is generally for the treatment of the body's stress or pain. There are different styles used in massage therapy, like Swedish massage. The most common type of massage is Swedish massage therapy. It involves soft, long, kneading strokes as well as light, rhythmic tapping strokes on topmost layers of muscles. Deep tissue massage is best for giving attention to certain painful, stiff, trouble spots in your body. Shatsu massage in Japanese, it is called finger pressure. For Shatsu massage, the therapist uses varied rhythmic pressure on certain precise points of the body. And some of the benefits of massage therapy is that its effectiveness for back pain, it can reduce the number of migraines a person has and also improve sleep. And for cancer patient, use as a complement to traditional Western medicine, massage can promote relaxation and reduce cancer symptoms or side effects of treatment. It may help reduce pain, swelling, fatigue, nausea, or depression. For example, or improve the function of your immune system. Here's the video of massage therapy.
Think about the power you hold at your fingertips. The power to heal, to help change someone's life. You already have most of what you need to turn that power into a fulfilling career. You just need to learn how to use that power.
Next is the meditation. It is a practice where an individual uses a technique such as mindfulness or focusing their mind on a particular object, thought, or activity to train attention and awareness and achieve a mentally clear and emotionally calm and stable state. Meditation can improve your immune system. For example, it is important to eat well and stay active during stressful time. But it is equally important to keep calm because stress can literally make you sick. Mindfulness meditation also improves sleep quality and in turn to quality life. By doing this meditation, you must go sa place na tahimik, then close your eyes, reduce thoughts in your heads, inhale, exhale. Sometimes they use relaxing music while meditating. Here's the video of meditation.
Find a quiet space where you'll be undisturbed for a period of time. Then sit cross-legged on a cushion or in a chair with your feet flat on the floor. Whatever your sitting position, make sure your back is straight but not too tense. Imagine a string from your tailbone pulling all the way up your spine to the highest point of your head. Softly close your eyes and begin to breathe slowly and deeply.
Next is the acupuncture. It is a form of alternative medicine and a key component of traditional Chinese medicine or TCM in which thin needles are inserted into the body. This acupuncture has seen as additional way to treat patients in certain medical conditions like chronic pain, depressions, and digestive problems. Acupuncture, seen as another form of energy work, that we can place a needle somewhere in the body and so itong needle na to will move energy so you feel better, more alive and think better. And the goal of acupuncture is to restore the balance of energy by removing stress, toxins from parts of the body that helps to improve the patient's overall health. Also uses heat, pressure, friction, suction, or impulses of electromagnetic energy to stimulate the points. Dito sa acupuncture, may specific channel siya or parts of the body na doon ilalagay yung needles. Like sa parts ng hands, dito sa may middle ng thumbs and etong finger na to, ang tinitreat niya is fever. Ang tinitreat niya is fever, sore throat, toothache, arm, shoulder, and stomach pain. And dito naman sa part na to ng hands, dito naman yung nilalagay yung needles para i-treat yung neck, cheek, arm pain, sore throat din, bloating, or stiff neck. So this is the video of acupuncture.
So with the acupuncture, there should not be any pain associated with it at all. You should feel just maybe a little mosquito bite when they first go in, but nothing painful. It's actually very relaxing, and oftentimes people will fall asleep during the treatment. So we're just going to start with this point by the arm. We'll check in with Rachel to make sure she's feeling okay. Does this feel all right for you? Perfect. And we'll do a point in the central to open up the sinuses as well. And 2 points by the side of the nose, and these also help to relieve congestion, so really great for seasonal allergies.
And last, the dietary supplement. It is manufactured product intended to supplement one's diet by taking a pill, capsule, tablet, powder, or liquid. A supplement can provide nutrients either extracted from food sources or synthetic. Dietary supplements used for a wide assortment of reasons. Some seek to compensate for diets, medical conditions, or for eating habits that limit the intake of essential vitamins and nutrients. Supplements, for example, supplements like calcium and vitamin D can improve bone health. Other people look to them to boost energy or to get a good night's sleep. Postmenopausal women then consider using them to counter a sudden drop in estrogen levels. But sinasabi din na hindi lahat ng dietary supplements is safe because they don't have scientific study or clinical studies that will prove that they are effective to treat illness. And now we will tackle the 7 principles of integrative medicine. First, return responsibility of care back to the rightful owner or the patient. Second, healthcare providers are educators and teachers to their patients because they are the one who will guide the patients to treat their conditions. Third, the patient is the healer with their own natural healing resources already within themselves. Yeah, because we there are that antibody who will heal us naturally. Nasa immune system or nasa loob ng body natin yun. Fourth, the healthcare provider's role is to help remove the barriers that interfere with the body's ability to heal and provide what the body needs to restore optimal health. Fifth, determine the root cause of the problem, only treating symptoms as long as necessary. So, habang symptoms pa lang yung nakikita, dapat i-treat na agad yon para hindi na siya mag-undergo na mapunta sa maging illness na. And sixth, do no harm. And lastly, be patient and trust the inherent wisdom of the body's ability to heal. Yun nga kasi nga meron tayong antibody na tumutulong na mag-prevent ng na i-attack yung immune system natin ng viruses. That's all. Thank you.
Thank you, Ms. Andoy, for your time in sharing your knowledge with us. We have learned a lot from you. And now, for our last but not the least speaker, where we also have given a chance to learn more, talks about the advantages and criticisms of integrative medicine that will be discussed by Ms. Marigel Castro, ang tirador ng salamin sa CSL.
Good day, everyone. So, here are the 5 advantages of integrative medicine. So, first, being healing oriented. Integrative medicine's focus, like the ancient systems, of traditional Chinese medicine and Ayurveda is about wellness, vitality, and healing, rather than focusing just on the disease. It begins with the assumption that there is a physiologic balance that is disrupted and leads to the manifestations of illness and disease. Regaining the body's natural state of equilibrium can restore this balance and promote health. Second, it focuses on the mind, body, and spirit. Too often, patients go to doctors with multiple symptoms affecting the multiple organ systems and see different practitioners for each of their problems. Integrative medicine puts the focus on how various symptoms may be connected and searches for root causes rather than just treating individual symptoms. The focus becomes restoring balance and considering factors that may affect the patient's ability to adhere recommendations such as cultural dietary restrictions or the inability to adhere to an exercise program because of work obligations. Third, emphasizing the therapeutic relationship. There is a new focus on the practitioner patient partnership, forcing us to look at certain questions. How has the clinician's role changed? Are there better ways to treat health problems that can only be managed, not cured? The integrative partnership guides and advises patients regarding treatment options. Together, practitioner and patient decide on the best plan of action. In the management of chronic diseases, attention is placed on meeting the patient where they are at the moment by addressing obstacles to lifestyle changes and treatment adherence. There is a higher likelihood of success with the recommended therapy. Fourth, personalized medicine. Recommendations may vary in integrative treatment plans according to each individual's unique situation. In tailoring treatment plans to individual needs, practitioners scrutinize the literature, often using the scientific method to evaluate alternative therapies the same way as traditional therapies. Integrative assessments are highly personalized. Patients are asked about everything from environmental exposures to personal relationships. All factors are considered when determining whether or not an individual stays healthy. And lastly, using all appropriate therapies. By combining traditional allopathic treatment options along with mind-body therapies such as yoga and meditation, a treatment plan is developed that utilizes the least invasive and most cost-effective therapies first. Attaining a sense of well-being is especially important in cases where cure is not always possible. Most integrative providers prescribe treatments amenable to scientific investigations. However, patients are not dissuaded from using treatments as long as the proposed remedies are proven to be safe. That's all. Thank
Next is the risk of integrative medicine. The treatment promoted in integrative medicine are not substitute for conventional medical care. They should be used in concert with the standard medical treatment. Certain therapies and products are not recommended at all or not recommended for certain conditions or people. The National Center for Complementary and Integrative Health is a good tool for researching a therapy you're considering. It's also important to talk with your healthcare provider before trying something new. It says here that integrative medicine cannot be used as a substitute from the conventional medicine. Why? Because there are conditions that integrative medicine cannot fully treat and only the conventional medicine can do. Not all the healing modalities or the practices that is being used in integrative medicine is suitable for all conditions of a patient. There are different kinds or different types of conditions of a patient that can be treated. For some, Integrative medicine can help them with their illnesses, but for other people, integrative medicine cannot help them with their illnesses. That's all. Thank you.
Next are the criticisms about integrative medicine. First, many conventional practitioners and medical scientists believe this to be a modern form of quackery since hindi pa nagpro-provide ng any credible evidence that they are effective, iniisip ng iba na quack lang yung integrative medicine. Second, some of the successes reported are placebo effects. Third, most ailments treated successfully are self-limiting disorders predominate in these areas of practice. So when we say self-limiting disorder, these are the illnesses or conditions which will either resolve or on its own or which has no long-term harmful effect on a person's health. Fourth, many of the approaches lack scientific proof. Fifth, relatively few studies are clinical, double-blinded investigations. Six, most references, such as books and papers, are not truly scientific. Seventh, publications and many reports are anecdotal. So it means hindi reliable yung mga reports about IM. That's all.
Thank you, Ms. Castro, for sharing your knowledge. And for this time, before we end our webinar, may I call on again Ms. Rhea Cerezo, ang kuripot girl sa aming klase, to sum up everything or highlight more the important things that has said earlier.
So, for today's webinar, the speaker talked about integrative medicine, and I would like to take this opportunity to thank you, for without you, this webinar would not be successful. So, as Ms. Pinolia explained earlier, integrative medicine, or IM, is a practice of medicine that reaffirms the importance of the relationship between the practitioner and the patient. Integrative medicine focuses on the person as a whole, meaning the practitioner also considers the patient's emotional, social, mental, spiritual, and environmental influence that affects the patient and that make them sick. Integrative medicine achieves optimal health and healing. Ms. Andor discussed to us some of the common practices used in integrative medicine and shows video clips about it. So the first one is aromatherapy, or sometimes it is called as essential oil therapy. Aromatherapy uses natural plant extract and its aroma to promote health and well-being. Next is the massage therapy. This practice manipulates soft tissues in our body and are commonly applied with hands, fingers, elbows, knees, forearms, feet, or you can make a use of a device. Next is meditation. It uses techniques such as mindfulness. It is often conducted by an individual in a quiet, peaceful, and calming place like the beach or beautiful sceneries. Next is the acupuncture. Acupuncture is one key component of traditional Chinese medicine, or the TCM. This practice uses needles and are inserted in our body. Acupuncture has also different types and are practiced depending on what the patient wants and the condition. The last is the dietary supplement. This can be taken as a pill, capsule, tablet, powder, or liquid. The dietary supplements goal or use and the reason why people choose this type of practice is to increase a person's quantity of consumption. She also explained the 7 principles of integrative medicine and the importance of it to the practitioners and also to the patient, because integral medicine focuses in building relationship between the physician and the patient. If the patient builds a good relationship with his or her physician, the patient won't feel shy to the physician and can express or tell everything what is going on. In that case, the physician will know the real reason why the patient is sick, and the physician will know what best calm therapy suits the patient better for fast recovery. Ms. Castro explained to us the 5 advantages of integrative medicine. IM is healing-oriented rather than disease-focused. The patient who feels different symptoms doesn't need to consult different physicians because integrative medicine uses holistic approach to treat the person as a whole. The integrative partnership guides and advises patients regarding treatment options. Not only the physician, but also patient involved in deciding what best of action they will do for healing. Also, integrative assessments are highly personalized. Patients are asked about everything from environmental exposures to personal relationships. Integrative medicine is not a substitute for conventional medicine care or the standard medicine, so there are some risks for the patients. For instance, certain therapy is effective to a patient, but it does not mean that the therapy will be effective to all patients. Its therapeutic effectivity will depend on every patient. Sadly, integrative medicine receives criticisms from other professionals and scientists that they consider IM a modern quackery since there are no credible evidence that proves the effectiveness of integrative medicine. Some of their success are placebo effect. Most ailments treated by integrative medicine are self-limiting disorder or they heal by themselves and they do not need any specific treatment. Integrative medicine approaches lack scientific proof and they said that publications and reports about IM are not reliable sources. But despite all of these criticisms that have been made, IM or integrative medicine is gaining its popularity these days because of its holistic treatment approach.
Thank you, Ms. Raza. And that's all for today. Thank you for your time, participants, and thank you for the efforts of speakers. We hope you learned a lot from this webinar. Thank you and God bless.
Thank
Thank
you.
you.
Thank you.
Bye-bye.
Bye.